COVID-19, what businesses need to know. An informed community training module. This short video will provide some quick and accurate information on the coronavirus. Your role and responsibilities as a business owner. Basics of the COVID-19 virus. How to assess risk of infection. Simple prevention measures. Your role and responsibilities for emergency management in workplaces. While responding to crisis and have implemented work from home measures, you must not omit your responsibilities as a business owner for your emergency procedures. Understand how many occupants you have in your building at all times and have a plan for them, remembering that your building may be quite empty and you still need to maintain a minimum warden structure or switch to after-hours procedure. There must be a working emergency control organisation, ECO, and Emergency Planning Committee, EPC. A meeting may need to be called so that there are adequate provisions put in place to respond to an emergency situation if one should arise. Whilst we are concentrating on COVID-19, it may be that another emergency occurs. Responsibility under WH&S laws with a person conducting business or undertaking PCBU nationally to ensure that there is adequate ECO structure in place to review, manage, train and communicate workplaces' emergency plans. This is the law, and it does not matter if some workers are home-based or working from your office. The ECO has to be maintained as per the emergency plan. Preemptive action. Here's why you should take preemptive action for this kind of crisis. Flatten the curve of infection by ensuring social distancing and isolation. Keep your workers safe and build trust, particularly when work from home is implemented. Implement long-lasting crisis management infrastructure that will help for future events, including an incident control team. ECO can perform this function with daily virtual meetings. What is COVID-19? COVID-19 is the name of the disease caused by the SARS-CoV-2 virus. Diseases caused by viruses have different names. For example, AIDS is a disease caused by the immunodeficiency virus HIV. COVID-19 is a title assigned by the World Health Organization that stands for Coronavirus Disease of 2019. Symptoms. Symptoms can range from mild illness to pneumonia. Some people will recover easily, while others may worsen very quickly. COVID-19 symptoms have been reported to be fever, flu-like symptoms such as coughing, sore throat, fatigue and tiredness, shortness of breath. Symptoms may appear 2 to 14 days after exposure to the virus. COVID-19 in Australia. In Australia, the people most at risk of getting the virus are those who recently returned from overseas, have had close contact with a confirmed case of coronavirus, remain in close contact with large groups of people. High risk factors for severe illness. People most at risk of severe illness and death from COVID-19 are over 65, pregnant, asthmatic, diabetic, immune compromised. Example, those on cancer treatments. How does it spread? Virus transmission is still being studied. There is evidence the virus is most likely spread through close contact with an infectious person, contact with droplets from an infected person's cough or sneeze, touching objects or surfaces, and then touching your mouth or face. Prevention. Good hygiene. Using a tissue and cover your mouth when you cough or sneeze. Changing the clothes you wore outdoors when returning home. Bathing and showering regularly. Hand washing. Wash your hands often with soap and water. 40 to 60 seconds of rubbing or singing happy birthday whilst lathering and washing. Social distancing. 1.5 metres is recommended for maximum risk reduction. Avoid close contact with others, such as touching. Stop handshaking and other physical greetings. Limiting social gatherings to less than 10 people. Self-isolation. If you are a confirmed case, you need to immediately isolate yourself to prevent it spreading to other people. Working from home and not being out in public is a practical measure for limiting exposure. Have items you need delivered. Stay informed. COVID-19 is an unprecedented event. And as such, scientific communities and governments are learning about this virus, its impacts on the human body, and our required responses as a community as we go. Stay informed with up-to-date information and stay safe. An informed community training module.